Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. We are going to take a look at where we stand globally in terms of COVID-19. The number of new infections is still rising exponentially due to the rampant spread of Omicron.
However, with Ukraine dominating the headlines, the pandemic has become an afterthought for many, despite it remaining a serious issue. For more, we connect to Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
So we heard the other day that the COVID-19 pandemic death toll globally had surpassed 6 million. Does this underscore to you that the pandemic, now entering its third year, is far from over?
No, I think the pandemic itself will be over soon, but the virus is not going anywhere. I know that in Korea, you have a very large number of cases right now, and it's been a very sharp rise in cases. But fairly soon you hit a peak, and then the numbers will crash down quite quickly. We've seen in other countries, the Omicron peaks are very sharp. I think at that point in Korea, it will be a good time to lift a lot of the domestic restrictions, and other countries are having the same experiences. So I think around the world, the pandemic will soon be over for most places. It would only be perhaps China and a few other locations that are still needing to keep measures in place because they haven't had their exit waves, their Omicron surges yet.
Right. Well, I hope we do get some of these restrictions lifted, especially the face masks everywhere. Can't wait for them to eventually lift that after all this time. But your second home is Hong Kong, of course. I believe you're still in London. But they're seeing their number of deaths due to COVID actually grow substantially. Now, reports say it's testing its entire population. That's 7.5 million people 3 times this month, apparently, to stay in line with mainland China's zero COVID strategy. I just want to ask you, what do you think of Hong Kong's strategy and, by extensions, China's? And as a sub-question to that, these numbers we're getting out of China, A, do you believe them? And do you think this zero COVID strategy actually works?
Yeah, that's a lot of questions. So firstly, for Hong Kong, we were doing really well in the first 2 years of the pandemic with the zero COVID approach. And then Omicron got in at the beginning of this year, and it took off. We had a lot of cases in the past month, particularly, very, very large number of cases. And unfortunately, the vaccine uptake in older people in Hong Kong hasn't been that high for many different reasons. So maybe too many to talk about now, but the vaccine coverage hasn't been high enough. And as a consequence, we've had a lot of severe cases, unfortunately, a lot of deaths. So the daily number of people dying from COVID in Hong Kong is more than the daily number of people dying from COVID in Korea, despite you also having a very large number of infections in a much bigger country than of course, the city of Hong Kong. Now, in terms of what's happening in mainland China, certainly they're having a number of outbreaks at the moment, some of which probably seeded by the outbreak in Hong Kong, unfortunately. The playbook in China is still zero COVID. It's to find cases, to isolate them, to quarantine their contacts. They'll do lockdowns and mass testing, etc. I think it will work, but it's getting more and more difficult because Omicron is so difficult to stop. It's so transmissible. So at some point, I'm sure that people are going to start saying, is it really worth it? Omicron's a bit milder, particularly if people have been vaccinated. Why do we need to keep doing this again and again and again, locking down, mass testing, etc.? Now, in Hong Kong, you mentioned the mass testing exercise. There's a plan maybe later this month or in April to test everybody in the city. But there's a different reason for what's happening in the mainland. In the mainland, mass testing is used to stop outbreaks in their tracks. In Hong Kong, the plan would be to wait until the epidemic's almost over, going down to a low level, and then help it on its way to zero with mass testing. And that's a lot of money, a lot of expense, a lot of disruption for something that's going to happen naturally anyway. So I'm not sure if it will ultimately happen because it may not be necessary.
And also, despite its wealth and widespread vaccine availability, the United States is nearing 1 million reported deaths on its own. Do you think such statistics undermine the argument that vaccines are effective in lessening the chance of death?
And there's very, very good evidence that vaccines are highly effective. I think you'll see it yourself in Korea, with the number of severe cases that are occurring, I'm sure the deaths that are being reported every day are typically in people who haven't been fully vaccinated. In the US, majority of the deaths occurred before vaccines were available or after they were available, but still in people who hadn't been vaccinated. Now, as time goes on, as people build up immunity, not only from vaccines, but also from infections, I think we'll see less and less impact of the pandemic. That's a good thing, but it's really sad to see so many deaths in the last 2 years from COVID.
Certainly want to echo those sentiments, Professor Cowling. Unfortunately, we're out of time, but we always learn a lot from you during our chats, so we appreciate it, especially you staying up so late in London to make time in your schedule to speak with us. Goodbye. Thank you.
Goodbye. Thank you.